Knock knock. First I'm going to wash my hands and put gloves on. Hi, my name's Peyton. I'm going to be your nurse practitioner student today doing your assessment. First I'm just going to take an overall general appearance of you. You look alert and orientated. There's no acute distress noted. Your respirations are even and unlabored. I don't have any odor or smell. You are wearing appropriate clothing. You have appropriate facial expressions. They're symmetrical and you're able to move all your extremities, so that's good. Next, we're going to move on to your head. So I'm going to start by just looking at your hair. It is curly, it's full, there's no missing spots. Then I'm going to look at your face, and I can notice you have a lot of facial hair. I'm going to look at your neck, and the facial hair comes down, but I don't notice any masses or discoloration of his skin. There's no lesions or lumps or anything anywhere. And then I'll look at your neck, and I don't notice anything there, just some hair, no pimples or anything like that. So next we'll start by just palpating the skull. I'm going to inspect the skull, and I also don't notice any lesions or masses inspecting it, and I also will inspect the scalp, and there's no dryness, lesions, masses there either. So then we can palpate. So I'm just going to look through his hair. I don't notice any lesions or masses. There's no redness or anything noted. Next, I will palpate his skull and head. And again, there's no tenderness noted. So then I'll move to the TMJ joint. I'll look on both sides. There's no redness or swelling noted there. Next, I'll palpate it. So do you have any tenderness there?
No.
Okay. And then we'll just have you move your mouth up and down for me. Good. And I don't notice any clicking or popping there. Next, we'll do your lymph nodes. So I'm just going to come in front of you. And first, we're going to start with the pre-auricle, post-auricle, occipital. Then we're going to come down below for the submandibular and the submental. And then I'll have you turn your head to the right, and we'll come along the pre and post cervical. And then we'll turn the head the other way, and we'll go along again the pre and post cervical. And then we'll come along the submandibular. And there's no tenderness or lumps noted there. Alright, so next I'll have you do a full range of motion. So just put your head all the way up and all the way down, all the way to the right and to the left. Good, he has full range of motion there. Next I will come look at your, you put your head just a little back, and I'm going to look at your trachea and thyroid. Inspecting it, I don't notice any swelling or noted. It looks symmetrical. Inspecting it, and the trachea is midline. So next I'll come behind you to first palpate your trachea. I am just going to come between the SMC muscle and the trachea, and the space is symmetrical on both sides. I'll have you swallow for me. Good. And then I'll palpate the thyroid, and I don't notice any nodules or masses palpating the thyroid. I'm going to move the trachea to the side a little and have you swallow there. Good, and then I'll move it to the other side and have you swallow there. Good, and then again, it's symmetrical, it's midline, and I don't notice any masses, nodules, or tenderness while doing that. Lastly, I will come across and look at your spine. So I'm just put your head down a little. I'm going to go from the hairline and palpate down to T1. Is there any tenderness there?
No.
Okay, and then I'm going to come along on the cervical muscles. Is there any tenderness there?
No.
Okay. And if I did notice that the thyroid was enlarged, I could listen for a root, but I didn't notice